Hi everybody. Today I wanted to talk about our introductory orthodontic course. It's called NOA 101, what every dental professional should know about orthodontics, sleep apnea, and TMD. In this course, we talk about first the fundamentals of basic orthodontic principles. We cover orthodontic classifications of malocclusion, why do we see so many malocclusions today, and why does malocclusion develop, and just why do we see so many patients with crowding and skeletal problems. Then we also cover different orthodontic problems, for example, crossbites, ectopic eruptions and impactions and how to address that. We cover different points about how to recognize these orthodontic problems and when to refer or when to treat, and how to decide if you're going to treat a case or you're going to refer that patient. We also talk about just in general how to educate patients about the orthodontic problems, as well as sleep apnea, snoring, as well as TMD problems. We tailored the class so it talks to specialists, general dentists, as well as their supporting team, for example, hygienist and assistant. I feel it's really important to get your entire team on board so everybody has a good basic understanding about all the different orthodontic problems, sleep apnea, snoring, and TMD problems that you face day to day in your practices. We encourage doctors to bring their entire staff and entire team. That's really the best way to grow your practice with well-educated patients, and so I think it's very important to get the entire team on the same page about these different clinical issues. Later on the course, we also talk about the fundamentals of how sleep apnea develops, as well as how snoring relates to sleep apnea, as well as what are the fundamental problems with sleep apnea, and how do we go about testing for it, how do we work with the medical doctor to get it diagnosed, and what are some of the treatment options for sleep apnea and snoring. A lot of the sleep apnea patients have underlying orthodontic problems, mainly orthodontic problems, which is skeletal problems. So I think it's important, if you're going to think about treating sleep apnea patients, that you understand the underlying orthodontic problems, mainly the skeletal problems. A lot of sleep apnea patients have an underdeveloped mandible or retrognatic mandible. That's when the jaw is further back, and it leads into obstructive sleep apnea. So we cover all the different problems that's supported by literature and different treatment options. All of our courses are tailored around well-published and peer-reviewed literature, so it's very important that we base our knowledge and our treatment on science and good literature support. So we do show you different literature for all of our orthodontic treatments that we recommend, as well as for sleep apnea and TMD problems. So we do cover those literature reviews. Later on in the afternoon of the course, we go into different diagnosis and treatment options for TMD patients with temporomandibular disorders, and we also talk about a lot of the class 2 patients can have what's called idiopathic condylar resorption. That means the condyles are resorbing and they develop a very major class 2 skeletal relationship. So it's important to recognize those problems too. We also talk about crossbites in mixed dentition, as well as young patients. A lot of the class 2 patients, for example, have a crossbite, so as class 3s. We do cover face mask treatment for class 3 patients. That's a very good treatment options for younger children, because after a certain age, especially around 12 to 13, face mask treatment to correct the maxilla becomes very difficult. So we wrap up the afternoon with a little bit of practice management. We covered 12 habits of most successful dentists. And we also cover, how to create a team that's well-educated and well-rounded to diagnose and treatment plan orthodontic, sleep apnea, and TMD patients. So I think you will really enjoy this class. It's more of a team-building class. I have taught this class in 13 states and 6 countries, and it's always very well received, and I think a lot of the team members really like it. And we offer this class in several different locations. And if you have any questions, you're always welcome to contact us, and you can see the locations for the next 101 class, which is titled What Every Dental Professional Should Know About Orthodontics, Sleep Apnea, and TMD. I hope you find this video helpful, and you can see the different points that we cover in the class under the registration for the course. I hope you find this helpful, and have a good rest of the day. Bye.